Hi, this is 5 Minute Videos review for the NCE. This is Dr. Pepe going over Domain 2 Intake Assessment and Diagnosis. And today we are going to be covering subdomain T, which states use pre-test and post-test measures to assess outcomes. Now, as the word implies, pretest is a assessment that one is given before any intervention occurs. So usually this is done in the intake process as you're gathering data. And then the post-test that usually occurs once a intervention happens or once there is some sort of a maybe there's a medication change or there's some kind of change that occurs, and what you're trying to see is what changes occur, whether it's a positive correlation or negative correlation, depending on the measure that you are using for the pre and post test. Now, the pre-post test design is a common type of experimental design. And again, the goal is to measure the intervention or treatment of an outcome by comparing the two types of scores. Something to keep in mind, especially when studying for the NCE, is that there are some limitations of using the pre and post test that can affect the reliability and the validity of the scores or of what you are trying to truly measure. One of the things is what they call the history effect, and that is when an external event or factors other than the intervention influences the outcome variables between the pre and the post test. So, for example, if the client is depressed and they get a promotion, they start making more money. Maybe that promotion was a historical event for that client, and it increased their happiness or their level of happiness, and that wasn't necessarily part of the therapeutic process. It just kind of coincided with when they're getting counseling. So that is a history, what they call a history event that affected the pre and post test intervention. Another thing that you should be aware of when looking at pre-post test are the maturation effect. Maturation effects occur when there's natural growth or development of the client. So if you're working with children, for example, and the client, um, over time naturally matures or develops, and it doesn't have anything to do with the intervention, let's say you're doing play therapy, then that would show an increase in an assessment that you're doing, but it wasn't necessarily because of the play therapy. It was because the child is developing and growing, and maybe they're better able to formally process some of their choices or whatnot. So we talked about the history effect, the maturation effect with pre and post test. There's also something called the testing effect. When a client becomes familiar with the test, or they're tested and with similar tests, over time they learn how to take the test. They know the format of the test, and they become more familiar, so their performance improves. So that's called the testing effect. And again, it has nothing to do with the intervention, but it's just the client becoming more familiar with what the test looks like. And then a fourth thing to keep in mind is the selection effect. So when participants are selected, or when they come to you in counseling, maybe they meet a certain criteria that can't necessarily be generalized to the all the population. Maybe they're higher income, maybe they're more educated, maybe they've had privileges. So because of those selections, they're able to show a higher level of growth. So those are the selection effect, the testing effect, the maturation effect, and the history effect are all different things to keep in mind whenever you're doing a pre-post assessment.